Hello, my name is Kristen Prelip, and I'm the Public Information Officer and Communications Manager for the Orange County Health Department. Welcome to the June 2021 episode of Public Health Chat. In each episode, we will meet some of the wonderful people who work in public health and will explore a variety of topics. This month, the big news is that although we are still in a pandemic, the Emergency Operations Center, commonly referred to as the EOC, will be demobilizing on June 30th of this month. This is by far the longest EOC activation in the history of Orange County. Prior to the pandemic, the longest activation was the 2004 ice storm for 2 weeks and 4 days for Hurricane Fran. Just to review, on January 25th, 2020, the EOC moved to a monitoring posture for COVID-19. This is the first day of the response. On March 13th, 2020, the EOC was fully activated and a state of emergency was declared in order to respond to the COVID-19 pandemic. That means that June 30th will be the 530th day of the response. Wow. With me today are two people who have been working on the response since the very beginning. Welcome to Orange County Health Director Quintana Stewart and to the Orange County Health Department Medical Director, Dr. Erica Pettigrew. Thank you so much for joining us. I'm so glad to see you both. I think that the general public does not know much about the inner workings of a health department. Dr. Pettigrew, can you tell us, what does a medical director do?
Thanks, Kristen. I'm excited to be here. I appreciate being asked. So a medical director of a health department is different than a health director of the health department, as Quintana is our health director. So I serve as the medical director. I've been in this role for over 4 years now. And really, my job is to provide the medical consultation for goings on at the local public health level. And so for Orange County, that means that I see patients in our clinics. I work closely with our communicable disease team on any sort of outbreaks. So pre-pandemic, we mostly talked about tuberculosis cases in the county, any rabies issues that comes up with animal control, if we have an outbreak of pertussis, norovirus, anything like that, I would be involved with those consultations. But then, of course, we have this global COVID pandemic, and so this role has definitely evolved and become pretty intense with all of the work that we've done at the health department.
Thank you. So, Quintana, can you help our viewers to understand how a health director and a medical director work together?
Sure. So the health director and the medical director actually work in tandem or very closely on a routine basis. I would say the COVID-19 pandemic has required Dr. Pettigrew and I to communicate almost daily for certain periods of our response during this pandemic. But, you know, in general, as Dr. Pettigrew mentioned, I consult with her anytime I am trying to make a medical or a clinical policy level decision that will impact the community at large. So we talk and communicate on a regular basis. We've been joined at the hip during this pandemic. So I think it's been very easy for folks to confuse our roles and interchange our titles. And for the most part, a lot of that is really okay, because any large or policy level decisions that the health director has made at this time that I've made, it has been in consultation and lots of communication with my medical director. I would say pre-pandemic, we met often to discuss some of the operational needs of our medical clinic. She provides the medical oversight of our providers. Like she said, we consult her about any communicable disease event, normally not as large or they don't last as long as COVID-19, but we really are partners and we talk on a regular basis. And so it has been a wonderful relationship. I feel very honored to be able to work with Dr. Pettigrew through this pandemic and pre-pandemic as well. Looking forward to what we will do post-pandemic.
I agree. And I'll just jump in and mention one big difference, though, to highlight between a health director and a medical director is that the health director, so Quintana has the power to quarantine people, isolate people, implement certain infection prevention measures. She has that vested police power and authority, whereas the medical director is more of a consultative role.
Okay. Well, that is fascinating, and I think most people don't know that, so thank you. So on past public health chats, we've typically begun each episode with an update from the health director on the COVID-19 pandemic. Since we are now focusing on recovery and also learning to live with COVID-19 as a part of our lives, I would like to ask both of you for an update. Dr. Pettigrew, now that 63% of Orange County is fully vaccinated and cases have dropped significantly, what do you want the Orange County community members to know about how to stay safe and healthy in coming months, and what to expect as we move forward?
That is a great question. So I'm very proud of the efforts that our team has undertaken at the health department to get our numbers as good as they are. And we are #1 right now in the state in terms of our vaccination rate. So I'm very proud of that, but we still have a long way to go. It's important for people to realize that we're still in a race to get as many people vaccinated as possible. There are several variants that are pretty worrisome, particularly the Delta variant that we're watching carefully and that has not seemed to come to the US much yet, but has really overtaken certain other countries and is a highly transmissible, possibly more dangerous in terms of severity variant. And so, being at, I think we're, 59% fully vaccinated, 63% partially, that's great, but we still need to do so much more. And then, of course, we really need to keep in mind that there are other measures other than vaccinations that are really critical and that we know work. We know masks work. And there's a lot right now about who has to wear a mask, who doesn't have to wear a mask, where we should be wearing masks. And I'm happy to go over that. But I think the bottom line is that it's never a bad idea to wear a mask. And in particular, if you have not gotten your vaccine yet, whether because you're less than 12 years old or for another reason, it's crucial that you continue to wear your masks and social distance, wash your hands a lot. And if you get sick, stay home and get tested.
Okay, thank you so much. So, Quintana, in your opinion, how is Orange County doing this far into the pandemic, and what do you hope the viewers will take in mind this summer?
I think the Orange County community has done really well during this pandemic. Our sacrifices as a community and as individuals have truly paid off. We have consistently had some of the lower case rates across the state during this pandemic. And I think this is a testament to folks practicing the 3 W's that Dr. Pettigrew just mentioned. I mean, we know that wearing that mask and waiting the 6 feet apart and washing your hands often, it worked. As we head into the summer and we begin to experience some of the lifting of the pandemic restrictions, I think the thing I would like for folks to remember and keep in mind is that there's value in washing your hands, right? It's something that we practice and we paid a lot of attention to during the pandemic, but it actually is a good public health practice. It's just a good practice in general. So I would like for folks to remember, wash your hands often. I want everyone to remember to cover your nose and your mouth when you cough and you sneeze. We really highlight that during flu season, but as we saw during the pandemic, there was a lot of value in that. Not only did we decrease drastically the rate of cold and other respiratory viruses, it also helped us with our COVID case count. So I think the Orange County community really did a great job, and I just want to tell them thank you. I appreciate their willingness to comply with all of our guidance and around keeping the community safe. And so I would say as we move into the summer, remember these things and continue to practice them. It's never a bad idea to wear the mask when you're out in public, whether there's a mandate in place or not. I would also really encourage folks that are eligible for the COVID-19 vaccination to get their shot. We know it has been extremely effective in decreasing hospitalizations and deaths related to COVID-19. So just know that we have both walk-in and pop-up COVID-19 vaccine clinics every week throughout the county. The vaccine is free and no ID or health insurance is needed to get the vaccine. So I encourage folks to go to our website, www.orangecountync.gov/get-your-shot, or call 919-913-8088 to sign up.
So even though Orange County has the highest vaccination rate in the state of North Carolina, we still have work to do to get all of our community members vaccinated against COVID-19. Dr. Pettigrew, I would like to ask you a few of the most common questions we get about the COVID-19 vaccines. We think that some people just need more information before they decide they want to get the shot. So here's my first question. Is the vaccine safe for people who have illnesses such as heart disease, diabetes, or those with cancer, or perhaps people who are obese?
That is an excellent question and something that I have been answering on an individual level for my patients as well. I'm a family doctor when I'm not working at the health department, and so I see patients at UNC Family Medicine. And so I would very much encourage people with chronic illnesses actually to get the vaccine because of their chronic illnesses. We know that people who have diabetes, people who have high blood pressure, people who have cancer can have higher rates of severe outcomes and even death with catching COVID. And so we want to protect them as much as we can, and this is an excellent tool to protect them. There is a question of whether the vaccine works as well in people who are severely immunocompromised. Now, this is somebody who is actively on chemo for cancer or something like that. Now, we don't know if the vaccine works quite as well because their bodies may not be able to mount the response, but they still should get the vaccine because it may help a little bit, and then everybody around them can also get their vaccine, which further protects that person who is more medically fragile.
Okay, great. Next question. Which vaccine is better, in your opinion?
So I do not have stock in any of these companies, and I am looking purely at the data. Now, I've read all of the data published for all three of the vaccines that are currently approved in the US. So that includes Pfizer, Moderna, and Janssen, also known as J&J. And right now, they all work really well. And so it's important to get the one that is available to you, the one that appeals to you the most, but there is not one that is clearly better than others. I've had people in my own family get all three different kinds. And so it's just important to get the one that you can get the one that you feel most comfortable with, but I encourage people to get any of those three that they can.
Great. And I should also mention that if people are unsure about the COVID-19 vaccine, maybe they just need more information or have some medical questions, they can also call us. The phone number is 919-245-6111. You'll just leave a message and a medical professional will get back to you. So next question. Why is it important to receive the second dose?
Yes. So I mentioned there are three different kinds, three different manufacturers, and two of those three, the Moderna and Pfizer, are a 2-dose series. J&J has the advantage right now, at least, of just being a one-and-done shot. So if you absolutely hate needles, absolutely hate shots, J&J is your friend. Get that one. It's a one-and-done. But it's important if you get Moderna or you get Pfizer to go ahead and get that second dose, because what we know in the data studying tens of thousands of people is that you get the first shot, it helps your immune system start to build a response, start to recognize the COVID spike protein. But really when you get that second dose is when your body fully can recognize it and fight it off. And so the efficacy, or how well it works, really skyrockets after your second dose. So it's really important to go ahead and get that second dose if you started with Pfizer or Moderna.
Great. And we should mention that here at the health department, you can get your second dose even if you received your first dose from another provider, no problem. Just come to one of our walk-in or pop-up clinics and just let them know you need your second dose and what kind of vaccine you had for your first dose. If you have any questions about that, you can give us a call at 919-913-8088. Okay, next question, second to last question. What are the side effects of the vaccines?
So some people, and actually the majority of people, don't really have many side effects. They may have a sore arm. That's the most common. But some people have nothing. They get their shots and they feel completely fine. Other people may experience headaches, nausea, maybe a fever, and some people don't feel good for a day or so, and that's also okay. That is their body's way of mounting the response. It's not dangerous, it's not worrisome, but it's uncomfortable. And so some people will strategize about getting their shot maybe the day before they have a day off work, or at least letting their work know, hey, I'm getting my COVID shot, I may need to call out the next day. And most employers are happy that their employees are getting the shot to protect them and protect their coworkers. And so hopefully they would be able to work with you. But those are the most common side effects. In terms of anything more serious, so there are a tiny, tiny amount of people out of the millions and millions who have had severe allergic reactions. This is something that every COVID vaccine clinic is prepared to deal with if it happens. But like I said, it is so rare that I've been running vaccine clinics since the beginning of this year, and we have not had any anaphylactic reactions, thank goodness. And it really is a rare event, but it's something that if you're concerned about, or really any of these medical questions, I just encourage people to talk with a trusted medical professional, talk to your doctor, talk to your PCP, talk to your nurse practitioner, who knows you and can really understand what your concerns are, because ultimately we want people to feel good about their decision to get the shot. We're not trying to convince anybody or coerce anybody. We really want people to get the information and make the best decision for themselves and their family.
Right. Okay, last question. Is there a microchip in the vaccine?
There is not a microchip in the vaccine. I have personally looked at the vials and pulled them up, and there are absolutely no microchips in those vaccines.
Great. Well, thank you, Dr. Pettigrew, for that important information. Before we close, I would like to ask you both one more very important public health question. After working, I think, 7 days a week during this whole pandemic, now that you've worked so hard for so many months and things are slowly getting better, are you going to take some time off this summer? Quintana, I will start with you.
Yes. I am hoping to take a week off really soon, and I envision walking through the sand, looking out at the ocean, taking several naps, and eating lots of good food.
Lovely. And Dr. Pettigrew, how about you?
That sounds excellent. I kind of want to go with you, Quintana. And you deserve that, all of the, amazing hard work that you've done. Orange County is just so lucky to have you as health director. I am hoping to get down to my parents' lake house. My parents are fully vaccinated. My cousins all got fully vaccinated. And so I'm hoping to take some time and hang out on their pontoon boat and eat a lot of hot dogs.
All right. Well, thank you all so much for everything you've done and for participating in this public health chat today. Stay safe and healthy, everyone. Goodbye.
Bye. Thank you.
Thank you.